अन्य श्री मिलिंद मुरली देवरा जी।
Thank you, sir. So I stand to support the Cess Bill, and I'm extremely thankful to our Finance Minister Nirmala Sitharaman ji for first bringing tobacco products under the central excise last week, and through this bill, now pan masala will come under an additional cess levy. Sir, मैं सबसे पहले आपके permission लेकर, I would like to remember my late father, who was a member of this house, who in 1999, I had conveyed this to the Honorable Finance Minister. He filed a PIL in the Supreme Court to ban smoking in public places. And it's his PIL. At the time, there were about 12 crore smokers across India. It's his PIL and the Supreme Court judgment, subsequently 2 years later, in 2001, which led to a complete ban on smoking in public places, from restaurants to train stations, airports, office meetings, which had a huge impact in reducing the number of second-hand deaths that could have arisen out of cancer. Sir, as far as pan masala goes, tobacco goes, there's obviously no debate and discussion as to the harmful, carcinogenic disadvantages of consuming these products. But I'd like to highlight a growing trend, which is a global trend, with regards to another product, which sometimes escapes the public attention, which is equally carcinogenic and also leads to cancer, heart disease, and lung disease. And that product is called alcohol. So in 2021, the Lancet Oncology study found that in India, alcohol contributes to almost 62,000 new cancer cases. Globally, WHO attributes 2.6 million deaths in just the year 2019 to harmful alcohol use, not necessarily to recreational alcohol use, but to harmful alcohol use. Recently, countries like South Korea and Ireland have started introducing prominent warning labels on alcoholic beverages, very similar to what you find on tobacco products, like a pictorial warning, which warns customers and consumers about the carcinogenic risks by consuming alcohol. And mind you, sir, this is also in a country like Ireland, where almost 2 to 3% of their GDP comes from alcohol consumption. But the government took a view that while we are earning revenue from alcohol, it's also causing other societal and health harms, and therefore we should put these pictorial warnings. Recently, in the United States, the Surgeon General identified alcohol as the third leading preventable cause of cancer, responsible for 100,000 cancer deaths and 20,000 cancer cases and 20,000 deaths annually. What is very interesting is that this trend in a country like the United States, which is known for alcohol consumption, the share of Americans under the age of 35 who drink has fallen in the last 20 years from 72% to 62%. So therefore, my limited suggestion, with the limited time I have to the Honorable Finance Minister, is very straightforward, that as we expand the scope of this cess bill, I would urge the Finance Minister through you to kindly consider a cess or a central levy on alcohol, not to prohibit drinking, but to deter excessive consumption. I'm also fully aware of the fact that the centre does not have the power to levy VAT and central excise duties on alcohol. That is the prerogative of the state governments. But just as through this bill, the Honourable Finance Minister is imposing a levy on the machinery used to produce and package pan masala, one idea could be to impose a central excise duty or a customs duty or even a compensation cess on equipments used in breweries and distilleries. For example, there's brewery machinery, there are fermentation tanks, bottling lines, packaging systems, distillation columns. All of these will serve three primary objectives. One is certainly they will increase revenue for the Government of India. Secondly, if we impose a customs duty on imports of these equipments, we can also support and encourage Atmanirbharta of these production of these equipments. And the third is that this will be a very subtle nudge against excessive alcohol consumption without harming what is a growing artisanal and traditional industry base in our country. So with these words, I want to congratulate the Finance Minister once again for very deftly tying revenue collection, the objectives of the Finance Ministry with what is now clearly a public health objective. Thank you very much.
Thank you. Mani Dr. Sikandar